Hi, my name is Becky. I am 41 years old. I started with Envoque MD in August of 2021. I had been on synthetic hormones for about 15 years. Still was having normal lab levels, but still being very symptomatic. I was gaining a lot of weight. I was very fatigued. So I had actually seen a commercial while I was having coffee one morning and decided, listening to what the commercial had offered, that maybe I should give this a try, and what do I have to lose? So I made an appointment, I came in and got started. I did the full panel of blood work to just kind of see where I was at and what I needed to do or make adjustments, and it was probably one of the best decisions that I've made. I'm an RN, I've been an RN for 15 years. I do know that the choices that we make about the food that we eat, or the lack of activity that we do, or even our choice of career, whether you're sedentary or you're sitting a lot, or if you're up and moving around, it really can have a big impact on your health. So I decided that I was just going to give this a shot, and the first year that I started on the biothyroid, I had lost about 10 pounds. And it just really, I was feeling so much better, literally within 2 weeks of changing from the synthetic thyroid to the biothyroid, but I just hadn't lost all of the weight that I was hoping to lose. I had heard about the semaglutide, knowing as a nurse that this was a medication for diabetics, but that it was gaining some popularity in using it kind of off-label for weight loss. And so I'd heard about that the summer of 2022. I had to think about this. And then I had gotten an email from Envoque saying that they were starting this weight loss program with semaglutide as well. So I jumped at the opportunity to enhance what I've already had results from, just from switching over. And I'm really glad I did. So not that women really like to talk about their weight, but when I started January 31st of this year. I weighed in at 221 pounds, and I am now at the point where I am starting to wean off of the semaglutide, and I am at 60 pounds as of today. So that is a huge huge progress for me. I did not expect these results. What I did when I started the semaglutide is I started off with the liver detox program that they had, or the 7-day liver detox that they had, and I really do think that helped jumpstart what I was doing. And then starting the semaglutide, I didn't have a lot of problems with the nausea. I think the compounded version that they offer here is help to kind of curb some of those side effects that we have when we take medications. But I really did not believe my scale when I would step on it, and I would just see a pound come off one day, and then 2 days later I'd see another pound come off, and then 3 days later I'd see 5 pounds come off, and then a week later I'd see nothing come off. So what I want to tell people, if you are going to try this program, is make sure you're following the nutritional guidelines. I have made and sustained a lot of dietary changes in my life, and that's one thing that, that's 85% of what your weight and your weight loss is doing, is you have to treat your food as fuel and not just comfort. So I've sustained a lot of the dietary changes, making sure you're getting active, but just keep in mind that you're going to have weeks where you are going to see great results, and then you're going to have weeks where you don't lose anything, or you might gain a pound back. But don't get discouraged, and just keep on the program, keep following those guidelines, keep making those healthier choices in your life, and I can only hope people have as much success with this program than I did.
Perfect. Thank you, Becky.